She moved to Saudi Arabia and she is living there currently. She is missing her periods. She has missed her periods for up to 9 months. And she is asking herself, what could be the problem? She is asking herself, why is it that she is missing her periods? When she was in Uganda, her periods were very normal. But now that she is living in Saudi Arabia, her periods have started to change. She has missed her periods for up to 9 months. This video is going to be in 2 languages, the English language and the Luganda language. So if you are okay with the English language, stay on the video. And if you are okay with the Luganda language, please stay on the video. Obango badde oli okay n'olulimi Oluganda olwaffe olwawano video gibeereko ngenda kuba mmaliriza mu lulimi Oluganda. Abuzza n'agamba nti yagenda e Saudi Arabia myezi 9 naye ate periods ze zitandise okubanga zibula. Actually amisinze periods ze okumala emyezi 9. Kwebuuza ku lwaki kino kiri bwe kiti. We yali wano e Uganda periods zaali normal naye ate olwagenda e Saudi Arabia periods ze zibuze okumala emyezi 9. When a woman misses her periods normally for at least 3 months or even 6 months or more than that, we call this amenorrhea. Amenorrhea is a term given to that situation when a woman is not seeing her periods. This is actually something that can happen when the periods disappear for 3 months or even more months. Now, the question is, what could be causing this problem? What could be causing amenorrhea? What could be making a woman to miss her periods? Remember, when she was still living in Uganda, her periods were very normal. Everything was very normal. But when she moved to Saudi Arabia, her periods disappeared and it's now 9 months. The first reason as to why a woman could actually miss her periods for up to 9 months, we could actually first of all think of a pregnancy. The first point we could take into consideration is a pregnancy could actually be the issue. But now, remember, she's saying that it's 9 months, she has not seen her periods. It is a tricky question because at 9 months, if it was a pregnancy, she could actually be ready, or she could have given birth, or she could be ready to give birth. But in the question, she was not so specific whether she's pregnant or she's not pregnant. But the first answer to this question is that a woman could miss her periods for 9 months when it is due to pregnancy. But if it is not a pregnancy and she is not seeing her periods, then there could be other causes of this situation. The first cause could be that there could be a dysfunction with a particular part in the brain known as the hypothalamus. There could also be a dysfunction in the functioning of another part of the brain known as the pituitary gland. And then, of course, there could also be an issue with her ovaries. We call this the ovarian system. So, when there's a problem with the functioning of this small part in the brain known as the hypothalamus, a dysfunction in the small part of the brain known as the pituitary gland, and then, of course, in the ovaries, if these 3 are not working in sync, if these 3 are not functioning as they are supposed to, then there could actually be a manifestation whereby her periods will not appear. So a woman could be missing her periods when there's a problem with the hypothalamus, the pituitary gland, and the ovaries. We call this the hypothalamus pituitary ovarian axis. The hypothalamus pituitary ovarian axis. If these 3 are not working in sync, it could be among the reasons. When I talk about the hypothalamus specifically, this is a small part in the brain, also known as a master gland, which actually releases a hormone known as the gonadotropin releasing hormone, GnRH. And then, of course, this hormone powers to a small part in the brain known as the pituitary gland, and then, of course, the pituitary gland is going to release 2 more hormones, that is FSH and LH. If you have been trying for pregnancy and you've done some tests, fertility tests, you could have come across a hormone known as FSH, a hormone known as LH. These 2 hormones come from the pituitary gland, specifically the anterior pituitary gland. So if they are not receiving correct signals, because the hormones work by signals or signaling. So if the pituitary gland is not receiving the correct signals, the correct amount of GnRH hormone, then they are not going to produce enough FSH, and then there's going to be low LH. Now, the challenge is that if FSH and LH has been disrupted, then there's not going to be more estrogen, or there's going to be a discrepancy, or there's going to be an abnormality in the estrogen hormonal levels, and also in the levels of another hormone known as progesterone. So if these two hormones, estrogen and progesterone, are not balancing, then there's going to be changes in a woman's periods. In other words, if at all they are not balancing, a woman could experience changes like amenorrhea, like in this particular question. She said that for 9 months she has not seen her periods, and I'm saying that number one, it could be a pregnancy, number two, it could be an issue with her hypothalamus, the pituitary and ovarian axis. There could be an issue whereby these three are not working in sync. These three could actually be disrupted. The next reason as to why she could have missed her periods could actually be due to environmental factors. Remember, when she was living in Uganda, everything was okay. East Africa, everything was okay, and probably maybe the temperature is different with that of Saudi Arabia, where she is. So the changes in the environment could have brought about the amenorrhea, what she's experiencing. So a woman could end up missing her periods when there's change in the environment. You could ask yourself, how can the environment affect a woman's period in such a way that maybe her periods disappear? Remember, when there's a change in a woman's environment, there's going to be also a change in a woman's hormones. Specifically, if probably maybe this change in the environment has brought about issues, for example, maybe stress. Maybe at first she was not like really so stressed, but now she's in a stressful environment whereby maybe she could be overworking, or maybe any other sources of stress that could be coming in. These can actually affect the normal levels or the levels of the stress hormone known as cortisol. Remember, cortisol is a fantastic hormone that is produced from the adrenal gland. The adrenal glands are those two small glands which are found on top of the kidneys. Specifically, there's a part in the adrenal glands known as the cortex. It produces a hormone known as cortisol. Now, high levels of cortisol hormone due to stress, this can actually travel in the bloodstream, send signals to the hypothalamus, send signals to the pituitary gland, telling it that, you know what, cut off the production of FSH and LH. And when FSH and LH hormone has been disrupted, then there's going to be amenorrhea, there's going to be disappearance of her periods. So the third reason as to why she could be experiencing no periods for up to 9 months and yet she is not pregnant, it could be due to stress. It could be due to change in the environment. There are other reasons, like probably maybe she could be on medications that could be causing this. For example, medications that are used in treatment of seizures and other brain issues. So this is actually part of the answer to the question, but remember, if you would like to learn more about fertility, you would like to get your questions answered, please, you can always connect with me on these numbers here, and then we shall be able to learn more about fertility. You could actually join my classes, which run for only 7 days, and then I will teach you about fertility. So if you are interested, you can send me a message on my WhatsApp. These numbers are on WhatsApp, and then we shall be able to actually begin on the fertility sessions. I will be able to teach you about fertility. You will be able to understand. You'll be able to understand your body much more better. Okay, so come learn fertility with me on these numbers. So mukono gwaffe abuze ekibuuzo n'agamba nti we yali e Uganda periods zaali zitambula bulungi, we yagenda e Saudi periods zaakyuka, ali kwebuuza ku lwaki kino kiri bwe kiti. Ne ngamba nti number one, ayinza okuba nga amisinze oba amisinga periods ze, maybe ng'ali lubuto. Omukyala waba ali lubuto, periods zigenda kubula. Kyalabayo kyokka kaba kasaayi ak'omwezi ogumu ke tuyise the implantation bleeding oba ke tuyise spotting. Kabeerawo nga kakonfaminga nti eggi lino eryabadde fertilized libayise the blastocyst oba the morula lyekute ku kisenge ky'anabaana liri kukula. So wajja kubeerawo akasaayi ako. Ekirala kiyinza okuba nga ayinamuko ku buzibu maybe mu changes mu changes oba mu hormones ze oyinza okusanga nga hormones ze tezibalansinze bulungi nga kyekiri okuleetebwa embeera eno okubanga ebeerawo maybe ne stress nga nyingi nnyo gwayagala okuyiga ku bya fertility jangu togere ku fertility nziremu ebibuzo byonna ku namba zange zino ziri ku WhatsApp ojja kubanga kwegamba naawe omanya ebya fertility oba ojja kuba ofuna answers ku bibuzo byonna gwabadde alina ebibuuzo nga maybe ebintu ebimu toli bitegeera